Hello dear students, today we'll be discussing the principal fibers of the periodontal ligaments. There are 5 groups of the fibers including the alveolar crest group of the fibers. The second one is the oblique group of the fibers. Then the third one is the interradicular group of the fibers. Fourth one is the apical group of the fiber, and fifth one is the horizontal group of the fiber. Now we'll be discussing these fibers one by one, starting with the first, that is the alveolar crest group of the fibers. Now these are the fibers that extend obliquely from the cementum to the alveolar crest. Okay, so these are going to run obliquely. From where? From the cementum, that will be around the cervical area in the coronal third of the root, of course, and that will be going obliquely to the alveolar crest. Now can you guess what is the function of these alveolar crest fibers? Actually, these are going to resist the extrusion, because these are the first fibers that will be tensed when you are trying to pull out the tooth, right? And these are the first fibers that will be stretched when you are trying to do the lateral movement of the tooth, and that's why its function is resisting the extrusion and lateral movement of the teeth, right? Now can you guess, if we incise these fibers, will there be any effect on the mobility? Actually, there is no significant mobility that will be seen, because these are not that great number, not that numerous number of fibers, and we have other 4 groups of the fiber that are going to strengthen the tooth. So these do not add to the mobility if these are incised. Okay. Then comes the oblique group of the fibers, the most numerous fibers of the periodontal ligament, and these are the fibers that transform or that transmit stress from the masticatory forces from the tooth towards the bone. So the stress will be transformed into the tension in the alveolar bone. Okay, now these fibers are the one which are going to bear brunt of the vertical masticatory load from the masticatory muscles, of course, right? Now the third group of the fibers, that is going to be the interradicular group of the fibers. As we try to understand it, these are going to start from the septum of the interradicular bone, right? And this is going to from the crest, actually these are going to start from the crest of the interradicular septum, and these are going to insert in the furcation of the multi-rooted tooth, and that's why interradicular group of fibers are seen in multi-rooted teeth only. Then we have the apical group of the fibers. Now these are the fibers that radiate from the apex of the bone toward apex of the root towards the alveolar bone or towards the socket. So we can say that these radiate from the cementum to bone at the fundus of the socket, and these are also absent in the tooth where the root is developing. When the root is not completely formed, of course we won't be having the apex, and that's why a apical group of fibers will be absent there. Then we have the fifth group of fiber, that is the horizontal group of fibers. These group of fibers lie at the right angle from the axis of the teeth. So these will be like this, horizontally. Suppose this is the axis of the teeth, these will be lying horizontally, and these fibers are responsible for resisting the mesiodistal movement. That means they maintain the mesiodistal width of the tooth. So these were the 5 important groups of the fibers, 5 principal group of the fibers of the periodontal ligament.